day to you all, and you're welcome to my YouTube channel, Dorothy Inspires. If this is your first time watching me, you are welcome. Today, I'm going to be speaking to you about the different teams within adult social care or within adult social work. I'm going to talk you through the different teams in adult social care and some of the things that you may wish to consider when deciding which team you want to work in. You may be a bit indecisive about which team you want to work in upon qualifying. Hopefully this video may be able to help you in making up your mind and point you in the right direction. In adult social care, we have short-term teams and we have long-term teams. So the short-term teams are teams that do not hold cases for long. For example, the team that work at the front door handling incoming referrals coming in. And then we have teams that hold cases for longer. So the team that work with clients who require longer-term intervention. There are also specialist teams as well, which I'll talk about later. Okay, so first of all, we're going to talk about the team that operates at the front door. So depending on which local authority you are employed by, the front door team is known as access and response team, initial response team, intake team, referral and assessment team, information and advice. These are just the different names for the front door team. Every local authority has a different name they call it, but they all have the same function and they all serve the same purpose. But you'll find that the setups and structures will differ slightly from borough to borough, council to council, local authority to local authority. So the structures will differ slightly, but they all serve the same purpose. So the front door team does very short-term work with clients, and they usually hold cases for no more than 6 weeks. So it's a short-term team, it's very fast-paced because of the volume of work that is coming in and the turnaround of work coming in. You may wish to consider working in this team if you enjoy fast-paced work and you're able to work very well under pressure. So you may consider this team because it's a short-term team. Okay, so we're looking at the MASH team now. MASH team stands for Multi-Agency Safeguarding Hub. You will find that every local authority's MASH function is set up slightly differently, but the main functions and purpose will remain the same. MASH teams are usually quite small in size because they tend to screen incoming referrals relating to adult safeguarding matters. They usually triage the referrals and make a decision as to whether a safeguarding response is required. The MASH team is not a case-holding team. They do not hold cases. In many cases, they will triage and try and resolve the matter where possible. If not, and it cannot be resolved and it requires longer-term intervention, then it will be transferred or referred to the most appropriate team to deal with. If there is a separate safeguarding team in the department, then most of the safeguarding cases will be dealt with by the safeguarding team. Safeguarding teams. Some local authorities have a safeguarding team, and the safeguarding team only deal with safeguarding matters, safeguarding concerns. But please note that not every local authority has a safeguarding team. So where there is no specific safeguarding team in the adult social care setting, so any safeguarding will be dealt with by the Multi-Agency Safeguarding Hub or by the main teams. So if you are somebody who enjoys safeguarding work and you prefer to work in a specialist area, then you may want to consider a role in a safeguarding team. Hospital social work. Hospital social work teams is a very fast-paced team. You are working with patients who have been admitted to hospital, and their discharge planning has to start from the moment they are in hospital. In a hospital social work team, You will have to be able to work in a fast-paced environment because it is a fast-paced work that they do. You will usually work with a multidisciplinary team, such as you'll be working with occupational therapists, physiotherapists, nurses, GPs, etc. If you enjoy working in a hospital environment and you enjoy fast-paced work, working under pressure, then this role might be for you. Usually when a client is discharged home from hospital and long-term work is required or may be required, then the community social work team will take over. So the community social work team is usually the longer term team or what we call complex team, etc. Okay, so now we're going to move on to the community team, sometimes called locality team and sometimes called complex care team. Again, it depends on the local authority that you work for. Every local authority has a different name that they call it, but the main function is the same. So the work of people who require longer term work and support. Okay, so the long-term team deal with clients who might have an existing care package. So they're already known to adult social care and they're already receiving services. The long-term team also deal with clients who are new to adult social care and who require a Care Act assessment. Again, it really depends on the local authority's setup. Some long-term teams only work with clients who already have an existing care package, whereas other long-term teams deal with people with existing care as well as people who are new to the service. So it really depends on the setup of the local authority that you're working with. If you're somebody that you know you're not able to handle fast-paced work or you don't enjoy fast-paced work, then working in a longer-term team such as locality team, complex care team might be for you. And you may wish to consider this team. Okay, the reviews team. The reviews team can review people who have a care package at home. They can also review people who live in extra care housing, extra care or sheltered housing, sheltered accommodation. They also review people who are in residential homes, care homes and nursing homes. Okay, so depending on the setup of the local authorities that employs you, it can be slightly differently. For example, some adult social care review teams are only set up to review clients who are in nursing homes and clients who are in residential care homes. So any other review, if the person is living at home in the community, it will be the locality team or the complex team that will review them. Whereas some local authorities reviews team review everybody. So whether if they're living at home, whether they're in residential home, whether they're in a care home, they review everyone in any setting. Some reviews departments only review people in nursing and residential care homes. So it depends on the setup of each local authority. This may differ. Community mental health team. The community mental health team supports people with mental health problems living in the community. The team usually employs social workers, they employ nurses, occupational therapists, sometimes psychologists, and other professionals. If you have an interest in mental health specifically, and you want to specialize in this area, then you may wish to consider a career in mental health social work. The transition team. The transition team work with people with special educational needs and disabilities from the age of 14 to 25 years old. They support them through their journey to adulthood, which is sometimes called transition, hence the title Transition Team. If you're keen on working with young people with disabilities, then this is a team that you may wish to consider. Learning Disabilities and Autism Team. So the Learning Disabilities and Autism Team is a specialist team that work with adults aged 18 years and over who have a diagnosis of learning disability and or autism. And there is a criteria in terms of who they can work with, and we will go into that in another video in terms of the criteria, and I will do a video specifically on learning disabilities and autism. social care department, there is a client affairs team that supports social workers in their work. Now, the client affairs team deal with appointeeships, and they liaise quite a lot with the Department of Works and Pensions. Their role is very, very important in supporting social workers in their work. In every adult social care department, there is also a legal team. The local authority employs lawyers or solicitors that work with social workers when we have to make an application to the Court of Protection, or if we're seeking legal advice about a matter concerning an adult that we're working with. Every adult social care department has a business support function that supports the work of the directorate. So again, depending on the setup of the local authority, the business support team may assist with correspondence and letters coming into the department. They may also support with cash loans and petty cash for our customers who might need it. They also support with the recruitment and the induction of new starters coming into the department. The work of the business support team is very crucial to the overall customer experience. The role goes far beyond the general administrative duties. The business support function is very important in adult social care. Every adult social care department should have a direct payments team or direct payments monitoring team. Now, the team usually works to support social workers with clients on their caseload that are in receipt of direct payments. The team's function will be to monitor direct payments and deal with any queries relating to direct payments which a social worker may not be able to assist with. There are also specific project teams that can be set up to do specific projects to clear backlogs in adult social care. For example, during the pandemic, the legislations were relaxed a bit. The rules and regulations were relaxed a bit. And as a result of that, it has created some backlog. So, for example, there were quite a lot of patients who had been discharged from hospital into interim beds or interim placements. And a lot of these, that was during the pandemic. And a lot of these patients have not been reviewed, have not been assessed since they were discharged into interim placements to determine whether their placement is suitable for them long-term or not. Now, these cases are referred to as D2A or discharge to assess cases, which I spoke about briefly in a previous video. So as a result of the backlog of such cases, additional project teams have been created and have been set up to review these clients. So sometimes there can be specific projects set up to do a specific piece of work or to clear backlogs. Okay, so here are just a few tips for you. Usually, if you are an inexperienced social worker or you've just qualified and you're seeking your first job as a social worker, you cannot always be too selective about which team you join. It doesn't always matter about the team that you join. I think the most important thing is that you're able to get social work role and get the experience that you need in social work. Sometimes it's about where the vacancies are, which team have a shortage of staff, and where the vacancies need to be filled. Sometimes the hiring managers will make a decision about which team they feel you may be best placed in, based on how you interviewed and your skill set and where your strengths lie. If you intend on having a long career span in social work, then it is beneficial to try and experience working in different teams across adult social care. You will notice that in my videos, I tend to make references to the word service user, customer or client. The reason why I do that is some local authorities' adult social care department refer to users of their services as customers and others refer to them as clients. Previously, we used to call them service users. That was the generic term across the board. But now we're moving away from the term service users because it's seen as negative in a way. So we're now calling them clients or customers. However, there are some local authorities that still refer to the users of their services as service users in adult social care. So when you join a local authority adult social care department, you need to go with the flow, whatever that they do in terms of the setup, you need to kind of adjust yourself to that setup. You might have been working for a local authority and then you change jobs, you go to another local authority. You will find that the local authority will do something differently or will do different things in terms of what you're used to. A lot of things depends on the local authority structure and their setup. You will find that local authorities will differ slightly in terms of the way they do things. So you might have worked for a local authority for a very long time, it could be 5 years or more, etc. And you change jobs, you go to another local authority and you find that they do things very differently. So it's about adjusting and learning and doing things the way that it's done in the local authority that you join. Thank you so much for watching me. I do hope that you've learned something from this YouTube video. Please support my channel by subscribing, sharing and liking my videos. Please do not forget to hit the notification bell so that you will not miss any of my videos. Thank you so much and I'll see you in my next video. Take care. Bye bye.